So I'm happy to go ahead and get us started this afternoon. Again, Carrie Knapp, Associate Director of Community Health with Chestnut Health Systems. So again, our ROSC Council has been extremely busy working on deliverables, and we have a lot of updates to share with you guys later this afternoon. But I think one biggest thing that I'm grateful for is simply just family. I live a few hours away from family, so I'm really excited to spend some time with them this week. Nieces and nephews are getting too big and they grow too fast, so really excited to spend some quality time with them. All right, Kat, I'll turn it over to you.
I am Kat Hayes. I am the recovery specialist for the McLean County ROSC. And I guess one thing I'm grateful for is my fiance is going to be finally doing the move-in process with me at our apartment.
Awesome. Thanks, Kat. All righty, Barb.
Hi, I am Barb Brumlevy, Community Health Specialist, and working on the McLean County ROSC. I also work on the Ford County ROSC, and just grateful to be here, grateful for my recovery, of course. That's like number one, and of course, family. So
Thanks, Barb. All right, we'll do Cammie and then Sandra.
Hi, everyone. I'm Cammie Garrison. I am the new Region 3 TA for the statewide walk that. And I've been here about three and a half weeks. So I am just learning new things every day. And every time I sit in on a meeting, I learn something new. So it's nice to meet everybody. One thing I'm thankful for, I just said this in the last meeting I was in a couple hours ago, is today I'm very thankful for this position that allows me to work mostly from home when it's cold outside. I haven't been feeling well. I just love being cozy and warm and productive in my own house, in my own space, and I'm very, very thankful.
Thanks, Cammie.
Sorry about that. Hello, my name is Sandra Beecher from Gateway Foundation. I am just getting over a really bad cold, but one of the updates that I have is that we are opening hopefully in January, February, and possibly doing a ribbon cutting and an open house in Bloomington for Gateway Foundation. We'll do outpatient, intensive outpatient, PHP, MAT. So more to come on that. And then I'm grateful for all the ROSC meetings. You guys have, all of you have really done an exceptional job and continuing to stay the long haul. And I'm grateful for family as well.
Thank you, Cammie. Thank you, Sandra. We'll do Emily, Andrea, and then Michelle.
Hi everyone, my name is Emily and I work at Bright Point at the Scott Child and Family Center. I'm a community services coordinator with our family support team. Hi Michelle. And I do have, I guess, an agency update to share. So in our Scott Child and Family Center, we have daycare and preschool. We do Head Start and early Head Start, and we do currently have some spots open. We do have a wait list. It's based on need, and we're just not getting responses from our wait list right now. So we're just hoping to fill the spots as soon as possible. So we serve 6 weeks to 5 years old, and I believe our spots are in preschool right now, but we're hopefully going to be opening a new infant room soon. So if you have anybody looking for daycare, send them my way. I will drop my email in the chat and I'll get you to the right person if you're hoping to make a connection here with us. And I just want to say that I'm grateful for the Bloomington Normal community and the resources that we have here, the abundance, and just the way that we're all able to connect, whether it's Human Services Council or ROSC or whatnot. I just really appreciate the collaborative spirit of Bloomington Normal.
I'm Andrea from Life Center. I'm the community reintegration advocate here. I assist people moving out of institutions and nursing homes out into the community. Lifestyle updates. We are obviously closed Thursday, Friday. We are looking for a 30-hour-a-week position in our Pontiac office. That's one thing we're trying to fill a position there. Other than that, I guess that's about it for Life Center. What I'm grateful for a great employer. I'll be off tomorrow, which is nice. traveling to see family, just giving my kids the opportunity to like visit with their however many cousins will be with this week. So that's all I got for you. Thank you.
And I'm Michelle at the Bloomington Public Library. I do community outreach, community engagement, and I drive the bookmobile. Some things at the library that are going on right now. We do have a lot of children's programs that are coming up, including a stuffed animal sleepover. You might want to check that one out. I want to get involved. And then some other craft items that we're working on for adults and teens. We are going to be closed Thursday and Friday, but also we're closing on Monday and Tuesday for construction reasons. So Monday will be closed all day. Tuesday will be closed until 5. So you could come in the afternoon or in the evening on Tuesday evening, but bookmobile and pop-up stops will still be going on. And so that's also what I'm thankful for, a couple extra days off for the weekend.
For sure. Absolutely. Thanks for sharing, Emily, Andrea, and Michelle. All right, we'll transition to Erica and then Michael and then Tim.
Hi everyone, I'm Erica with the Prescription Playbook. We're an opioid education and awareness campaign. The only real agency update I have right now is that next Thursday, myself and one of my other team members will be presenting at the Illinois Association of PE Health Dance and Recreation Conference. I know it's a mouthful. But it's in Tinley Park, and so we will be doing a presentation on mental health and substance use disorder and the preventative factors, risk factors. So just something fun that we're doing and have going on right now.
Great. Thank you, Erica.
My name is Mike, and I'm the Central Illinois outreach worker for Oxford House. So Saturday, I opened up the Oxford House in Champaign for 9 men. It's already almost full, so I'm hoping here soon I get to open another one. Sunday, I celebrated 17 months of sobriety, so it's been a really good weekend.
Awesome. That's fantastic.
Congratulations.
Yep. That's all I got for that.
I am Tim Kane. I'm a licensed therapist here at Heartland College. And I'm going to continue the trend. I am also thankful for family. We have got 3 Thanksgiving get-togethers coming up and a 16-month-old. So this is the first year she's going to be kind of aware of what's happening, you know, and all the festivities. So I think that's going to be super fun. I'm really looking forward to her enjoying that.
Awesome. Thank you for sharing all. Sounds like your plates are going to be full, Tim, but that's exciting. And congratulations to you as well, Michael. That's really exciting news. Really proud of you. Awesome. We'll transition to Alan and then Marisa and then D'Amica.
I'm Alan Reed. I'm a residential tech, part-time residential tech at Chestnut, and I'm sober and cancer-free.
Awesome. Thank you, Alan. All right, Marisa.
Hi, everyone. My name is Marisa. I'm with McLean County CASA. I guess I'll say that one thing that I'm thankful for is all the room that I'm going to make in my stomach for all this food that I'm about to eat.
Awesome. Definitely something to be thankful for.
Hello, everybody. I am D'Amica Kirkwood, and I am with Prairie State Legal Services. I am one of their community resource specialists. And I am thankful for family, but mostly thankful for my grandchildren because they give me the drive to keep getting up and doing what needs to be done every single day. So no PSL updates.
Perfect. Thank you for sharing all. And then last but not least, we have Nolan.
Hey, everybody. I'm Nolan, Community Health Specialist with Chestnut's Center for Community Engagement. And the only update that I have is that our Faith and Recovery Initiative, the trainings are ready to go. So if you are a part of a faith community or know some people that are deeply involved in their faith community and would like to hear about this Faith and Recovery Initiative, please reach out to me because we're ready to start connecting with faith communities all across the state. And then one thing I'm thankful for is all the activities that I have going on this week. And so it's going to be a fun little weekend. So I'm looking forward to it.
Thank you, Nolan. And if you wouldn't mind putting your contact information in the chat, Nolan, so folks can reach out to you if they're interested in the Faith and Recovery Initiative, that would be awesome. All righty, we're going to go ahead and transition now over to our PowerPoint for today. All righty, it's hard to believe it's already November and we're celebrating Thanksgiving, but again, our team has been extremely busy the last 6 weeks working on various deliverables for our ROSC Council. And we really just want to take a moment to say thank you for all of your input and guidance as a council. We really could not have put all of this together without your input and just the different insight that each and every one of you are seeing within the Bloomington-Normal area. But ultimately, as Emily even mentioned earlier today, it has just been really neat to see all the incredible collaborative work that is going into this community. And that is really what we want to highlight today, is how much amazing hands and feet there are in this Bloomington-Normal area working towards our recovery community. So really today we have various discussion points around some of the deliverables that we have completed. We wanted to take a moment to review the health survey check results. That was that survey that was sent out to our ROSC Council, really just to kind of gather your insight as to how are things going? Are we moving in the direction that you think is beneficial? Are we meeting the goals of our strategic plan? Are we attending to the things in our community that need attending to? So we're going to review some of those results with you today. We'll also take a look at our gap analysis that we completed, along with our asset map, our communication plan, our outreach plan, and then also some high-level overviews of our FY24 strategic plan and some of the key priorities that we're going to be focusing on in the next 9 months. And then we'll wrap up our meeting today with some ROSC updates, contact information, and just some general 101 things that we plan on covering. So a lot of high-level overview items to walk through today. I will mention that the majority of our updated deliverables are on our McLean ROSC virtual resource guide. So there will be various QR codes provided throughout the PowerPoint today. Feel free to take a moment to pause and scan that QR code, and it'll take you directly to, again, that virtual resource guide where you can download and view and access those documents and take as much time as you would like to review and sit through those. They are pretty long documents, and so please use them for whatever discretion you think is appropriate. Our staff has worked extremely hard in putting all of that information together, so we want them to be utilized not only by our ROSC Council, but ultimately by the community members of McLean County. So diving right on in today, I'll turn it over to Barb, again, just to kind of talk about the FY24 health survey check results. Oh, Barb, I think you're muted.
I don't know when I'm going to ever get over that one, but sorry about that. But as Carrie said, this is the health survey check that we had sent out, and really wanting to, it was really geared towards learning public and provider awareness of ROSC, also substance use disorder condition services, supports gaps and concerns in McLean County. And there are just 10 questions. And overall, as you can see here, were some of the results. There's the full results in the actual assessment plan here, the strategic plan that you can see when you get a QR code. But anyway, so many, over majority of people indicated that they are pleased with the direction of ROSC and feel it's positively impacting the community, which is great. I loved that 81% indicated that they understand what a ROSC is and would be comfortable explaining it to someone who's unfamiliar with that, because I feel that that's one of the biggest challenges, hurdles that we've gotten to, because in the beginning, ROSC, a lot of people, didn't understand, and it took a long time for even me to really grasp what it is. So it was really great to see that a lot of you could explain it to someone else, and that's what we want. Word of mouth, just get it out there, get more people involved. And as you can see, recovery housing was rated a top key strategic priority goal for McLean ROSC. That is really, I would say a lot of ROSCs in general, that's going to be one of the number one challenges that we would love to try to really key in on. Also, increasing awareness of local recovery supports and services was the next rated top key strategic priority goal for us. And then another big goal that we have this year is outreach for rural McLean County, because you know, it's not just Bloomington Normal. I've lived here all my life, and I know a lot of people in the smaller towns always come to Bloomington Normal, but we would love to do more outreach out in those smaller rural communities. So that was just some information that we got from that health check that was very interesting and good to know.
Awesome. Thank you, Barb. And thank you to those on this call that participated in the health survey check. Again, we really value your input and insight into how ROSC is doing and some of the initiatives that we're working towards. So thank you for providing that overview, Barb.
Mm-hmm.
All right, moving right along now, I will go ahead and transition over to Kat to talk about our FY24 gap analysis.
I did the same thing as you, Barb, started talking without me unmuting myself. So for our gap analysis this year, we kind of had a two-part strategy. We gathered information from you, of course, our lovely council members, which we got with that health check survey, along with just soliciting feedback. Sorry, reading something down in the chat. I got distracted. I'm a little squirrel brain today. It's almost Thanksgiving. Anyway, our two-part strategy, as I said, we got feedback from everyone on the council, which was great. Also through that discussion breakout session we had in October, we got a lot of great feedback. Another strategy we used for just looking at what were the notable gaps within McLean County was reviewing the McLean County Mental Health Action Plan 2022 update. So with that, the county and the Behavioral Health Coordinating Council kind of identified 6 priority areas that a lot of which also align with what the ROSC does. Those include focusing on youth, 21 and under. Access to care was a big one. Justice involved individuals, the crisis system within McLean County, housing, as Barb had noted, support groups, and then rural McLean County outreach. So with each of those, just looking at some of the major issues they've found and that we kind of concur with our strategic plan update is for youth. We really don't have the capacity for providing services. So one of the things we'll be focusing on is looking at how we can increase services for youth within McLean County. Access to care, that's a big one that's also highlighted in the Community Health Action Plan for 2023 to 2025. And really a big part of that is the fact that we don't have a lot of psychiatric providers. And we also have a pretty significant medical staff shortage. Looking at the individuals who are justice involved or impacted, one of the big things that I didn't realize, and it's been kind of nice to see we're kind of working towards that within the last fiscal year, is underutilization of the problem-solving courts as a means of diversion. That's something we will be continuing to work on as we partner with our local problem-solving courts and hopefully along with the McLean County Reentry Council. Crisis, there were quite a few different things under here that were noticeable gaps. Again, looking at lack of resources or services for youth under 18. Crisis and mental health training for first responders was another one. As part of that training, all the police departments have been trained in CIT or crisis intervention training, but they're wanting to look to update that. Another one is a big one I know the county is working on is the timely referrals. That's having real-time communication between different crisis providers, and that is something they are currently working on. Housing, as Barb mentioned, that's a big one, not just housing within McLean County, but specifically looking at access to housing that can serve as supportive housing, recovery housing, or, you know, just that transitional or temporary. We've got great resources now, but we're still needing to explore other solutions. A continued one is just development of new and diverse recovery and support group meetings. We do have quite a bit of diversity, but we're always wanting to try and see what we can do to support differing and diverse needs. And then rural McLean County outreach. In my involvement with the ROSC, I haven't seen as much in this area as we would like to have. So over this fiscal year, we're going to be doing some very concerted effort to do some outreach. Beginning with, we'd like to kind of do an asset or resource mapping of what those different organizations, key community assets look like for those communities. And then, as Carrie had mentioned, if you want to look more at what we've done for our asset mapping, and then our resource mapping, you can scan the QR code down in the corner.
Thank you, Kat. And speaking of asset mapping, I will transition to cover that briefly in this slide. So our FY24 asset map, our team really approached this process really through a three-part strategy. Some of those strategies Kat had previously just mentioned. The first part of the strategy was taking a look at the McLean County Mental Health Action Plan from 2022, really just to dive into what McLean County has historically done well, but also what we've accomplished towards various outlined goals and objectives in that specific plan. The second part of our asset map was taking a look at an in-depth review of the McLean County Community Health Improvement Plan for 2023 to 2025. So again, taking a look at what community partners and community collaborations have been involved in towards the achievement of those community health improvement goals. The third part of our asset mapping was taking a look at the McLean County ROSC FY24 community resource map, really to help us identify what recovery supports, what community resources have been specifically valuable to the work of the ROSC, but ultimately to the McLean County recovery community. So all of these assets were further categorized by one or several of the SAMHSA's 4 major dimensions of recovery. So that was taking a look at health, home, purpose, and community. So at its definition, health is more categorized in terms of overcoming or managing one's disease or symptoms. The home piece of that is having a safe and stable place to live. Purpose is really conducting meaningful daily activities that can include things like jobs, school, volunteerism, family caretaking, etc. And then lastly is that community piece. So having the relationships and social networks that provide support, friendship, love, etc. To a specific individual. So as you can see up on your screen today, when we put all of this information together, and it's in a very extensive document, again, that can be accessed by scanning that QR code, we identified that there are 297 unique assets in McLean County. And that is just worth taking a moment to reflect on, and definitely something to be grateful for in this season that we're in. But it has just been so awesome to see the level of collaboration and support that there is within this community, and everything that we are working towards to addressing some of our community's highest priority needs. So definitely worth checking out this document. Feel free to share it with folks that you serve. serve or other individuals in your service area. There's a lot of information in there and just really dives into some of those unique assets that we see within McLean County. The next part that we're going to discuss today is our FY24 outreach and communication plan. Again, just due to the extensiveness of each of these documents, we're unable to provide, an in-depth review of each of these. However, again, feel free to scan that QR code and the jot form will pop up and you can access each of these documents through that platform. But really our communication plan is an overview of how our team will communicate our goals, our vision, mission, values, etc. to the McLean County community. Also within this plan, we identify various stakeholders that we plan on focusing in on, but also the key messages that we plan to include with those outreach efforts or those communication efforts. Various communication approaches, but also just a general timeline of how these efforts are going to be carried out. We've identified specific underrepresented sectors within this plan, and some of those have included people with lived experience. So that includes both individuals in recovery and impacted loved ones. But also taking a look at recovery allies, judicial or legal services, the LGBTQ plus community, multicultural communities, local and state government, rural community, veterans and active military, and some of those faith-based communities as well. So that's just a few of those sectors that we have identified to be as underrepresented, and ways that we're hoping to specifically provide outreach and communication strategies to them in the days ahead. Taking a look at that outreach plan, again, this is just simply an overview of where the ROSC is focusing its activities and education. Some of this data was pulled from other community surveys and assessments, but also from our ROSC Council through various conversations that we've had in meetings, breakout discussions, health survey check, etc. So some of those activities include stigma reduction and education, sober recreation activities and events, our sober living and stable housing, development and sustainability of support groups, but then lastly, taking a look at the adolescent supports and services. So kind of how do we tie all of this information together, if you will, and how do we continue to prioritize some of these key things in the days ahead? So feel free to check out those documents when you have a moment. And if you have any questions or follow-up concerns or things you'd like to chat about, our team is always happy to discuss that with you. All right, I'm going to briefly turn it over to Kat now to do a strategic plan overview as it pertains to our SWOT analysis. Oh, Kat, you're muted again.
We've had not a lot of updates to our SWOT analysis, but some big new strengths within our community have been actually developments from the Center for Human Services, both the behavioral health urgent care and their new recovery community center, which is named A New Horizon. And I will do a little bit of a plug and we'll send it out with just announcements when we do our notes. They are doing a enrollment drive tomorrow evening from 5 to 8 p.m. If you go on their website and just click on, it should be under their new Recovery Community Center tab. Other strengths we've developed within the last year is our virtual resource app and our new Sober Social Guide coming to the community soon as we're getting ready to print it. Our problem solving courts collaboration was a great strength we added. And then increased community trainings and outreach. We did quite a bit over this last fiscal year and we're planning to do more. New weaknesses that have been identified. Taking a look, one of them for the justice involved individuals or justice impacted is they do not have a universal mental health screening tool across the justice system for doing that diversion from the justice system for people who have behavioral health issues. Again, as I had mentioned previously, they are wanting to do a refresher course on the crisis intervention trainings for local law enforcement. Public housing barriers is a big one for housing within McLean County, and that can include entry requirements and tenant screenings. And as we identified just from some of our data, we still have lack of adequate recovery supports for underserved populations, such as veterans, young adults, older adults, and immigrant communities. Our new opportunities, as I said, we're going to be doing very specific targeted outreach to the different sectors that Carrie had mentioned on the previous slide. We're looking to do more in-person sober social events. We're hoping to plan more in-person, hopefully collaborations within the community. That way we're, getting that fostering of community with those organizations. Creation and distribution of ROSC literature in the community. You told us you want more, we heard you, we're working on it. And we are working on our partnership in collaboration with a New Horizon Recovery Community Center. And then we're going to be working on the process of doing talent assessments of all our wonderful council members, because we want to give y'all as many opportunities to be engaged with us in ways that are meaningful and important to you, not just like, hey, come attend a meeting. We all do that. If we can, be engaged in that way that's very meaningful specifically to you, we want to do it. And then looking at some of the new threats we've got going on, we've had a reduction in the number of health service providers. That was kind of really exacerbated over COVID. So it's longer wait time for getting in with people. I know for one of the places I was trying to get in just for primary care, it was going to be like in April. So it's a big need for getting in with care. And then also there's underutilization of the crisis care continuum due to lack of awareness and understanding. Again, that's something the ROSC has done a little bit of work on to educate what that looks like within McLean County. And we look and anticipate partnering with the Center for Human Services for how we can best support their new behavioral health urgent care. All right, so now that we've looked over all of our data, over our different analyses and whatnot, we will now cover what are our key findings and also just our very key strategic priorities for the rest of FY24. As evidenced by both data from the county, data from y'all, safe and affordable, supportive and recovery housing. We're going to be looking for ways that we can do things. We may not be able to go out and purchase a property, but we're going to find ways that we can do things to push the needle towards change. Rural McLean County outreach and targeted underrepresented sectors. That is something I've actually started the process on of learning more about our rural communities. And we're hoping over the next year to be a little more intentional with our outreach efforts. We will continue to do development and implementation of sober social events and activities that may not look like ROSC run activities, but we are looking more to partner, as we want to be able to get that sourced out to our community partners, get them some business and get them spotlighted so more of our citizens can benefit. Again, we're looking at ways to increase local adolescent supports and services. That's probably going to be more an exploratory thing right now rather than implementation, but we'll be doing some research on that and just talking with some key community partners. Exploration and development of some recovery support groups, also promotion of existing ones. Again, we want to be a good community partner. If you've got new meetings that are coming up, we want to support you. We want to promote for you. You can hit us with information to put on our app. you can hit us with information for social media. We will also be doing development and implementation of educational and training opportunities for local recovery supports and just mental health in general. We've got a wonderful partnership going on with McLean County RISE, which is the county-wide trauma-informed initiative. So we're very much looking forward to partnering and bringing some more trauma-informed trainings to the community. And of course, we are always open to, if you have ideas for upcoming meetings that you presented on a topic, or you think it's a topic we should present on, we want to bring the trainings to you that you want.
Awesome. Thank you so much, Kat. And then I will turn it over to Barb to talk about Narcan, and then we'll take it from there.
Yeah, I just wanted to let you all know again that if you're interested in receiving free Narcan in McLean County, you can contact one of our coworkers, Randy Derrig. Her information is up on the screen. And also, if anyone's interested in receiving any Narcan training, free Narcan training, please email. The email is there up on the screen, or Randy, or really, you could contact any of us and we will get you to who you need to talk to. And I just truly think that Narcan should really be in everyone's first aid kit. So, just get a hold of Randy and she will get you covered on that. And it's really easy, and the training does not take long, and it's very, very easy, and it won't, it doesn't hurt anyone. It only helps save lives.
Awesome. Thank you, Barb.
And then, as Kat had mentioned, our sober social guide, it is completed. And if you scan that QR code, it will take you to it for a digital version. We are working on getting that printed out here soon. And as soon as we get that information, we will get that to you. So we will actually have a printed version as well.
Righty, and this is something that I'm excited to announce, but coming soon, we are in the process of developing ROSC 101 binders. So what that will look like is just a compilation of various documents, not only to provide to new ROSC Council members, but to our existing ROSC Council members as well. Just based off of those health survey check results, even 80% of folks said that they feel comfortable speaking on ROSC, but really we would love that number to be 100%. So part of the ROSC 101 binders are going to be some talking points. So if someone is out in the community, they really have general talking points to go off of to really help that person understand what ROSC is, what it is that we do, and the value that we play within McLean County. In addition to that, we also plan on putting our one-pager, our brochure, our virtual resource guide information, but then also all of those different plans that we just discussed. So that can be a tool that you hold on to and can refer to as often as you need to, but then simply just some ways to help with ROSC. As Kat previously mentioned, one thing that we would like to prioritize in the days ahead is really understanding the talents that each of our ROSC Council members brings to the table. We greatly appreciate your involvement with attending our meetings, but we recognize that your involvement goes past just attending meetings, and we would really like to dive into what interests you and the impact that you want to make within McLean County, and how can we translate some of your talents and interests to the various deliverables that we discussed today. So we are excited to be putting together this information, and we'll be reaching out to you for distribution of those binders too in the days ahead. But we wanted to make a quick announcement on that today, and again, more information to come. All right, I'll turn it over, Kat, to talk about some Sober Social Subcommittee updates.
Oh, so we had a wonderful Recovery Month event end of September. It was a lot of great work, a lot of great partnership from the community. Great turnout as far as having people from the recovery community there. We had potential tentative plans for a holiday party. We came back together after our Recovery Month event in October, and we looked at things with the busyness we've had with deliverables over the past 6 weeks. And the planning committee came to the conclusion that we did not have enough time to truly plan out a holiday party that our community is deserving of. So no holiday party this year, but we will be looking to try and promote different things that are going on in the community for holiday events on our social media. We will be doing a repeat of one of our really great family events, which is our family fun nights at Grady's, which I believe will probably be tentatively next June. We are also looking at the possibility of doing a film showing on a mental health or substance use recovery related film. We've got some tentative dates for possibly January or February of next year. So look for more information on that. And then we're going to be looking at other things we might be able to do for other recovery friendly activities that for, just some socializing and recreation. Again, we'll be exploring some of those things we can do to partner with different organizations. As much as we do love hosting our own events, we also want to make sure that we're partnering. So more information on that to come. If you're interested in getting involved more with us as we're planning out those activities over the winter months, you can join us right now. We're doing every other Tuesday for about an hour from 11 a.m. to noon, and that takes place virtually via Microsoft Teams. If you're interested, go ahead and send me an email at cmhayes@chestnut.org.
Awesome. Thank you, Kat. And I will just make a plug. We recognize that Tuesday timeframe from 11 to noon doesn't work for everyone. So at any point, if you or folks within your agency have specific ideas, please feel free to send those to our team, and we would be happy to share those with the social subcommittee. We really want to hear from you and what the community needs as we're making some of these events come to life in the days ahead. Alrighty, and I will turn it over to Barb to conclude our meeting today.
Well, okay. It looks like it's that time. We've got through the meeting, and I know that was a lot of information, but really, if you can print out those forms, the actual strategic plan, you can look at it on your own time and kind of look over that. But we just wanted to let you all know how grateful we are for each and every one of you, and we couldn't do this without you. Want to wish you a happy Thanksgiving, but I also want to just open it up to any questions, thoughts, concerns that you might have. We can go ahead and do that right now if anyone has anything they want to throw out there, any questions, thoughts, concerns.
I was just going to say, don't feel too bad about the holiday party because there is so much going on. And I think almost another thing, not only for you guys planning it, but for people to attend, that's kind of adding to the holiday stress. And so doing something after, even better. So I think it's a wise decision.
Thanks, Michelle. Yeah, that doesn't make sense because there is a lot already. Yeah. You're seeing stuff and and January and February are always months where it's kind of like, oh, I need to get out of the house and do something.
Yes, exactly.
Yeah, thank you.
And with that, we're really going to try and do a little bit of digging on social media, along with just looking at the pathogram for those holiday events coming up to share. That way, we're not able to do something, but we want to show people that there are fun things to do over the holiday season.
Yeah. Anything else or?
Oh, I had one more thing. Since Kat mentioned the pathogram, I don't know if the word has made it to you all yet. But Ryan Opalk, who is doing a lot of the pathogram stuff, is looking for agencies that would like to be like, I think he's calling it like an agency spotlight, So I just wanted to pass along that message because I think that would be great for ROSC to be a spotlight on the pathogram.
Awesome. Thanks, Emily. All right. Well, okay. So as what we have up here is all of our contact information. So if something pops up, you have any questions, any ideas you want to, pass along, we can be reached at any of these emails up here, and also the McLean County ROSC at gmail.com that will, get to everyone as well. So I guess with that, we're gonna let you know the next meeting. It's December 19th at 3:30 to 4:30. And if it's like any of these holiday months, it's gonna be here like tomorrow, so it'll be here before we know it. But it'll be via Zoom again, and we look forward to seeing all of you. And we just really appreciate each and every one of you taking the time out of your busy days to join us here. Thank you.
Thank you, everyone. Happy Thanksgiving.
Yes, happy Thanksgiving.
Happy Thanksgiving.
Thank you.